I've been practicing dentistry since 7 years, and I'm a maxillofacial prosthodontist and implantologist. I'm currently in UK now. I'm practicing in UK now. So it's morning here, and it's an afternoon there. I think, right? What's the time there now, guys? I think you're from different places, right? Different countries.
Yeah. So here yeah. 3 to 13.
Yeah. What countries you are from? Uh,
I am from India and I'm living in Bangalore.
yeah. All right. So I don't want to waste your time just by uh, introducing yourself. Yeah. So can we go to our topic? Yeah, guys.
Yes. Yes. Yes.
Yeah.
Yes.
So our topic is navigating common dental challenges and building lifelong healthy smile. Right. So you got the point, right? What's in that?
Yes.
Yeah. So I don't want to make it like a kiddish thing. I'm just taking the class like I'm taking for adults because you're super kids of the future school, right? Right? Is it audible?
Yes. Yeah.
Yeah, yeah. So uh, coming to the topic, why is it important to have a wonderful oral health for you guys, for everyone? Yeah. So the thing is, in order to communicate with people, uh, you need a beautiful smile, right? You need a beautiful smile, and you should have beautiful teeth to communicate with people, to speak with people, and for socializing with people. And no, not but not but the least, for you're chewing, for eating food, you need a good occlusion. You need a good teeth for having food, right? So it is important. And uh, considering the dentistry, as far as the dentistry is concerned, dentistry is not just about the oral health. It has so many relationships with your general health also. So it's having many effects on your general health. Like it is directly related to your cardiological health, your neurological health, your uh, pulmonary health, and it can lead to oral cancer in some cases if you are not taking care of properly, and if you're having some bad habits, and if you have a diabetes, it's a relationship with that, and there are so many relationship with that. I'm not going more into that, but I'll go some superficially, and I'll explain you what, and it will come across. Yeah. So as far as everybody knows the layman terms, there are two things. One is dental caries, and these are the two common diseases which happens uh, in the oral cavity. One is dental caries, the tooth decay, and the periodontal disease. That means the gum, the pinkish part, or whatever color it is. This area. Can you see the pointer there? Yeah,
Yes.
yeah.
Yes, sir.
So yeah. So the disease which causes this area is known as the periodontal disease. I will explain you what periodontium is after that. It will come across again anyway. So this is known as the gum. This fleshy area is known as the gum, and everybody knows this is a tooth part, and which is attached to that. This is known as the gum. And the dental caries means everybody knows what a tooth decay is. So there will be a hole on the surface for your teeth, or tooth, because of some bacterial activities. It can be if you're not brushing properly, if you're eating more carbonated foods. Yeah, there are many reasons. I'll come across anyway. So this, just understand the things. This both are the basic diseases which carries over your teeth, and these are the basic steps you should follow for maintaining your oral hygiene. So these are the basic things. Um, Brushing your teeth properly, at least twice daily, or after every meal. It's not possible anyway. After you can, you're not sitting at your home and having your food all time. right? So it's not possible anyway. At least twice daily. That's fine. Yeah. If you are brushing your teeth twice daily, that will be wonderful. And floss your teeth regularly. Um, how many of you floss your teeth regularly?
So I have flossed my teeth 0 times in my entire life because I don't even know what dental floss is. I've never used
Yeah. Yeah. Anyway, I'll explain you guys what the dental
What
floss
is
is and how to
floss?
do it.
How do you use it?
Yeah, I will explain you. It will come across. Yeah. There is a slide on that. Is that okay?
Yes.
Yeah. So a proper diet means you should have the meals which is compatible for your oral health and your body. I'll come across that also. And rinsing means you have to rinse your teeth using the plain water once after your food, and also by the uh, mouthwash. There are lots of kinds of mouthwashes.
Also never tried mouthwash before.
That also will come across. Yeah, that will also come in our topic. There's a slide on that too. Yeah. Yeah. And you have to go for regular dental checkups. Means that is the bread and butter for us, right? For a dentist, you have to come for that, for keeping the smile wonderful.
I've had a couple dental checkups in my life.
You haven't gone, right? Because
No,
your oral health is so good.
I went to the dentist a couple of times before, and let me
Yeah.
tell you, I did not like it because I was 9 back then. So yeah, you can continue. By the way,
Not audible for me. Yeah. Say it again. Sorry.
I did not like going to the dentist when
You
I
don't like to go to the dentist, yeah?
was because
Not at all. What about a normal doctor? Yeah,
same.
medical doctor. Same. You don't like, right? So there is a no there is a
Back when I was
situation
9. That was back when I was 9. I'm okay with going to the dentist now.
now. Yeah. Oh, that's
I
okay. Yeah. So
I
if
was
if if
going to the dentist
if
when I was 11.
you yeah. So if you get a pain, then you will be okay. I believe
Okay.
people come to the dentist when they have pain. Mostly. Yeah. Anyway, we'll discuss it later. Yeah. So coming to the next topic, this is the normal anatomy of a tooth. Can you see it, guys?
Yeah.
So this is very important. You have to watch it properly, because if you are not seeing this properly, you won't be able to understand the further topics, because these are some technical terms which are used in the dentistry, and the basic things. Actually, this is a basic superficial thing you should understand in order to understand the dentistry. So, as you all know, this is the crown part. You can see here, this is the crown part, coronal area. This is the crown part. From here to here, this is known as the crown part. It consists of enamel and dentin and pulp. I'll come across anyway. And this part is known as the root. This is known as the root. Yeah. So, and I'll come to this side. So the coronal area consists of an enamel, a dentin, and a pulp, a cementum, a periodontal, and the coronal area, then the root area consists of cementum, periodontal. I'll explain it anyway. And there are nerves and separate. So enamel means it's a outer covering of the teeth, which is the strongest part in our body, more stronger than a bone. This is the strongest part in our body, and it is less abrasive, less corrosion, means corrosion resistant, and it's very strong. And, and next is the dentin. The dentin means it consists of dentinal tubules. It communicates with the pulp here. So I'll explain pulp afterwards. And it is having some communications. It nourishes the whole tooth. There are dental tubules inside, and that causes the tooth sensitivity. Everybody has heard of sensitivity, I believe. You have heard it of mostly in the ads of toothpaste, like Sensodyne and all. So that this dentinal tubules that will mostly leads for the sensitivity, because if there is a caries on this, it can leads to that. I'll explain that afterwards. And This is the pulp. The middle area of the tooth is known as the pulp. The pulp means it is the most important part of the main part of the tooth, which consists of nerves, blood supply, yeah, which consists of nerves, and many blood vessels inside, and the connective tissues, all that inside the pulp. Yeah, and the cementum, as you can see here, this is the. Can you wait for 1 second? 1 second. I'm not able to make it as full screen. Please wait.
Sir,
1 second. It's not. I'm not able to make it as a full screen. 1 second. Let me try again.
I think it's at the, you see there at the down 60% on there,
1 second.
next to that.
Yeah, I got it. Yeah. So, as I've told, the pulp is very important. You should understand the pulp much better because the pulp is the important part which you have to consider while you're considering the tooth. And the cementum is the area where there's a strong hard tissue. This actually the tooth is having two areas. One is hard tissue and one is soft tissues. So the hard tissues means it's enamel, dentin, cementum. All will comes under that, the hard tissues. And as I've told, the pulp is a soft tissue. Means all it consists of nerves, blood vessels, and some other connective tissues. And even the see, you can see the periodontal ligament here, this area. So that the periodontal ligament, the fibers will attach from the bone to the tooth, to the cementum, which you can see here, which will withhold the tooth inside the socket. You can see here inside the socket. That will withhold the tooth inside the socket of the bone structure. I believe you got a basic idea about the tooth. And see, this is a common disease, dental disease, uh, which is commonly found, as you all know, is the dental caries. Means there will be a hole on the tooth structure because of due to various reasons. The extent of the caries will be different in as you take care of your dental health. Yeah, if you don't take care of at this part at this age, means at this stage, it will further goes down, and it can lead to a much bigger one. So in these cases, you have to go for a root canal treatment, or if it goes much further, you have to go for an extraction method, means plucking out the tooth when the root canal treatment is not possible. So I'll come across anyway. I'll go through that afterwards. Yeah. So these are the reasons for the dental caries. This is the most found reasons for the dental caries. So if you have a poor oral hygiene means if you don't brush your teeth properly, and if you they as I've told before, if you don't do the dental floss properly, or if you don't use the mouthwash, not for everyone, but in some cases, uh, all that leads to dental caries. And if you consume more sweet and sticky foods and carbonated drinks, all that will leads to more that will lead to dental caries. And next is bad and worn out fillings. That means if you have fillings, if you have a filling, like the filling means uh, if you have a dental caries, you will drill there. Everybody knows. If you have gone to dentist, you will be knowing that if you have a caries inside a tooth, you will drill the tooth and you will fill it with a cement, or either it can be an amalgam, uh, anything. So if that goes bad, or partially if it goes off, that leads to a bad and worn filling. So that will also leads to further aggression of the caries, that is known as the secondary caries. So the caries will come from there, where if the filling is gone out. And dry mouth. The dry mouth is when you have a less salivation. Means if you don't have a proper salivation in your mouth, means if you don't have much saliva in your mouth, that will also lead to dental caries. The reason is that actually your saliva is a medicine inside your mouth. So that will make your mouth environment more alkaline. So acidic environment more will leads to dental caries. Uh, the bacteria, there are many bacteria inside your mouth, which is healthy, and which is not good for your mouth also. So all that environment together, um, the bad bacteria mostly will live more in the acidic environment, and that leads to the dental caries. So if you have a dry mouth, if you don't have a proper salivation inside your mouth, that will lead again to the dental caries. And the crowding of teeth means if your teeth is not aligned properly inside your mouth, means that leads to sticking of foods in between, and again that will leads to the dental caries. If your teeth are not aligned properly, um, you can chew properly, and the food will stick in between, and that will also lead to the dental caries. So I believe you understand what dental caries is, right?
Yeah.
Yeah. So these are the main reasons, means these are the primary reasons for a dental carie. That means the carbohydrate, more consumption of carbohydrates. It's not more consumption of carbohydrates. If you are consuming more carbohydrate, obviously there will be sticking of carbohydrates on your teeth, uh, and the bacteria. Bacteria, I mean, there are so many bacteria, streptococcus, staphylococcus. There are so many bacteria. Anyway, I'll come across that. Oh, that will uh, these two factors basically leads to the dental caries, because in the modern era we have more of refined carbohydrates. We're consuming a lot of refined carbohydrates, and that means chocolates, like some kind of chocolate which stick on the teeth, and the carbonated drinks which you're consuming a lot nowadays. I believe some people, not you guys, but the common public is consuming a lot of refined carbohydrates and the aerated drinks, the carbonated drinks. All that will increases the acidity on the tooth surface, and that leads to dental caries. And see, these are the ways you'll understand you have dental caries. Means these are the ways to diagnose by yourself you have dental caries. Means if uh, you are getting a food stuck in between your teeth, you will understand you will be having a dental carie. And if you have a bad breath coming out, means the technically the term is known as halitosis. In dentistry, we will call it as halitosis. There are many reasons for a bad breath. But if you have a decay, you'll be having a bad breath. Your friends won't come to talk with you, and you'll be having a toothache. This is one of the most commonly seen symptom means if you have a dental carie. And tooth sensitivity. You'll be having sensitivity while you're taking a cold or hot food or cold drinks or anything. You'll be having a sensitivity on the surface, means on your tooth or the teeth. Yeah. So these are the preventive measures which you have to take, which you have to consider uh, for in order to prevent the dental caries. So you should maintain a good oral hygiene um, to get rid of the caries, for the progression of caries. So good oral hygiene means you should brush properly. As I've told before, you should brush properly. You should use dental floss, the same, and fluoride application. So this topic is very important in dentistry because there are still discussions going on about the fluoride application. Like there are many things. If you're consuming the fluoride above a level, like see, there are many things, many ways to take fluoride on the surface of the tooth. So it's a topic of discussion. So anyway, I'll discuss here. So first is home care. Home care means anyway, next slides are coming on that. And professional application means by a dentist. Home care means, and you know that you have to do it by yourself at home. And professional application. And next is scaling. Scaling means it's just a cleaning of teeth. Uh, the layman term which you use, cleaning. Scaling means it's a technical term. Ultrasound scaling. There are so many types of hand scaling, ultrasound scaling, which is done by the dentist. And pits and fissure sealants. Anyway, I'll explain it later. You won't understand by the term. So as you see here, this is a thing which mostly in our country, in India, mostly the dentists will do, fluoride tray application. You have to apply, we'll do that by applying some paste which contains the fluoride and we'll apply on the teeth. So what that will do is, that will prevent caries to happen on the surface of the tooth. And in case of kids, like when the kid is below the age of 6, the tooth anatomy is different in case of young adults. So the thing is, it consists of hydroxyapatite crystals. The enamel layer consists of hydroxyapatite crystals. I don't know if you'll understand when I'm talking the technical terms. See, the surface of the enamel contains hydroxyapatite crystals, a thing called as hydroxyapatite crystals. And when you're applying the fluorine, the fluoride, the paste which constitutes fluoride, it will convert the tooth structure from hydroxyapatite crystals to fluoroxyapatite crystals. That will prevent the oozing in or the imbibition of the bacteria inside your tooth. So that's more technical. I think you just understand badly. So next is fluoride home care. That means anyway, your toothpaste, normal toothpaste, will contain fluoride. So if you're brushing properly, that will do that. And as I've told before, the mouthwash. The mouthwash will mostly contain fluoride, and if you do that, that will cover. And scaling. Scaling means, in layman term, we just call it as cleaning of tooth, cleaning of the teeth. So people ask you sometimes, the people will be having many doubts, like if you're doing the scaling regularly, if you're doing the cleaning on the teeth regularly, whether there is a chance for chipping of your enamel. Some people have many doubts, like like that. Like mostly the people will be having the doubt if you're doing it regularly, like once in every 6 months or once in every year, is there is a chance for chipping of your enamel, or that will affect your oral health in a bad way. So nothing like that. If you're doing properly every 6 months or every year, not for the young adults. I'm talking about the ones after 18 years old. So if you're doing it regularly once in every year at least, you'll be having a wonderful oral cavity. So what scaling is? Removal of infected deposits inside your mouth. That is basically the term scaling means. And what are the infected deposits? It will be plaque and calculus and the stains. The stains means there are many reasons for stains. It can be either by smoking, or it can be either by some medications which you take, like tetracycline and all, from the surfaces of the tooth. I'll explain it later anyway. So simple procedures by a dentist keep your gum healthy and firm. So this is a basic thing. It is a simple procedure done by a dentist which will make your gum healthy and firm. So this is basically the procedure is. The picture depicts here, this is a ultrasound scaling. They're showing the ultrasound scaling on this. So what this will do is, this one will will be having a certain vibrations. This tip will be having a vibration, and it will spray some jet of water from there, and that will chip off all this plaque and calculus in between the teeth, and also from the area of this gum. So that will do. This is known as the basically the scaling, known as the scaling, because people will be having so many doubts whether that will distract your enamel surface. Nothing like that. This will just chip off this plaque and the plaque and cartilage from the in between the tooth structure, and this is just a suction which will suck the water from here, the excess water from here from the mouth. This is a suction tip you can see here. This is a ultrasound scaler, and this is a scaler. This will be having some vibrations, and this is a suction tip which sucks in the water from the oral cavity. The saliva, or there will be more salivation when you're doing this, and the saliva, it will suck in the saliva and the excess water from the mouth. And how often it should be done? It should be done like once in every year, or whenever you get time. Like at least once in a year will be better. And any problems with scaling? There is no problem with scaling. There will be like if you do scaling properly in proper visits, your oral you'll be able to maintain your oral health better. And can it damage my teeth? No, there is no way. As I've told before, there is no chances. There is no evidence. There is no research articles. Nothing about you will spoil your teeth just by doing scaling. So this is a before and after pictures that depicts the this is before scaling and this is after scaling. So not just after the procedure. This will be after 1 or 2 weeks. So you'll be having some calculus and plaque stain everything on the tooth surface, teeth surface here. So after the scaling, the infection is gone and the inflammation on the surface is gone, and the gingiva will attach to the tooth properly, and all the stains from the surface of the tooth is gone. So this is a healthy teeth. And coming to the treatment for caries, there are several kind of treatments. There are many treatments as far as the dental caries are concerned. So this is a filling. This is known as a filling. Here you can see this is the amalgam filling, and this is the composite filling. The white color one. There are many fillings. There are 100 types of fillings in dentistry. I'll discuss a few. So the silver color one, which you can see here, it is known as the amalgam filling. Amalgam filling means we'll use uh, silver and mercury for the filling, which is less often seen nowadays. We don't use much this kind of filling, but it's very strong. And nowadays, I'm practicing in UK now. So in UK, they're using it more because it's stronger. But there are many debates going on this. There are many discussions on this in the articles too about the health issues on this. But still, some people consider it as a better treatment option because it's a strong method of restoration. But the basic problem is it is not aesthetic as the white colored restoration. And here you can see this is a composite restoration. Composite restoration means it is a type of cement which is used for the restoration, which is almost resembles the color of the teeth. It is available in different shades, which matches for your teeth. First, initially, what we will do is we'll be having a shade guide. So there will be different shades of a teeth. We'll just keep the shade guide on the surface of your teeth, and we'll check what shade is matching for you, and that shade we'll take that shade and we'll do the restoration with the same. So there are different shades for the composite, and there are many other cements too, like um, we'll be having uh, hundreds, as I've told, uh, the same tooth colored ones. And coming to the next, see, this is a root canal treatment. Root canal, so everybody will be in your life, everybody might have come across this terminology, root canal treatment. So what a root canal treatment is? So when your caries, so everybody understood what caries are. So when your caries affects below the dentin, the second layer of the tooth, and if it involves the pulp, means it involves the soft tissue area inside your tooth, we can't do a restoration because it is a soft tissue, and it is a there are blood vessels inside, there are connective tissues, nerves inside. With a normal restoration, it's not the solution with a normal restoration. So what we will do is we will drill the teeth like this. So we'll drill the teeth like this, tooth like this, and we will remove all the pulp, the infected pulp inside the tooth. Will extirpate. The term is extirpate all the infected pulp inside from inside the tooth, and we'll do a restoration. We'll do a healthy restoration using gutta percha. There are many materials, gutta percha, and above that we'll do another restoration, and we'll place the crown above the tooth. So that is a basic thing about the root canal treatment. And the final one, if there is no way you can protect the teeth by even by root canal treatment, or if some people are not willing for the root canal treatment, the only way is for the extraction. You have to pluck the tooth from your socket and you have to throw it away. That's the only way. That's the final way. And these are the two technologies. These are the two diseases which affects your soft tissues below your teeth. These are the gum. So the inflammation on this area of the gum is known as gingivitis. This is gingiva. Gingiva means the gums. As I've told, these are the gums. The technical term in dentistry for gums is gingiva. And wherever you see the itis, itis, that means the inflammation. Wherever there is an inflammation, that will depicts the itis. And you can see here, this are the gingiva. This is a gingivitis. Gingivitis means an inflamed and residing of gums. The gums will comes below the line of where it is supposed to attach. That is known as the gingivitis, and there will be inflammation on the gingiva. And the periodontitis means there will be an inflammation on the periodontium. So you can see here, this is a periodontium. As I've told before, the structure here is known as the periodontal ligament, and the whole structure from here to here, this structure is known as the periodontium. And if there is an inflammation here, or if there is an infection here, it is known as the periodontitis. Just understand it. So these are some symptoms. If you have periodontitis or gingivitis, if you have periodontitis or gingivitis, these are the symptoms. But these are the things which you will make to know whether you have it or not. So you'll be having some bleeding gums. So blood will come outside your gum. That means you will be having a gingivitis or periodontitis. Swollen or red gums. If you have that, that means you're having either gingivitis or periodontitis. Residing gums means, see, you can see the residing gums here. If it is going below the area, see, if it is below going below the area which is supposed to attach, so there will be a gap between this. This is known as the residing gums. And if the gums are pulling away from the teeth, same thing. See, if it is going away from the where it is supposed to attach, it's also known as that will also leads to gingivitis. And the black and yellow deposits on the teeth, as I've told, the plaque and calculus, loose or sensitive teeth, and the bad breath, and the pus. Even if in some cases the pus will come outside from the oral cavity, from the tooth socket, all that. So, what causes the gingivitis and periodontitis? Same thing. If you have a poor oral hygiene, as I've told before, and some hormonal changes. Hormonal changes means you'll be having many hormonal related diseases. Means the thyroid is a hormonal related disease. Even the diabetes is a means if you have a deficit of insulin secreted by your pancreas, it is known as diabetes. So there are many hormonal changes happening inside your body that will all leads to this kind of diseases. And certain medications which are taking in day-to-day basis, that will also leads to the same thing. And poor nutrition, if you are having the food which does not contain enough amount of vitamins and minerals, that will also leads to this disease. Ill-fitting dentures and braces means dentures means basically the replacement of your teeth inside your oral cavity, the replacement of teeth inside your oral cavity if you don't have a teeth after the extraction. So if it is not fit properly inside your oral cavity, that will also leads to gingivitis. And the braces means the if you have a malaligned or if you don't have the teeth aligned properly, we'll do some ortho treatments. I'll come across anyway. And smoking, if you smoke regularly, that will also leads to gingivitis and periodontitis. If you have diabetes, there is a chance you will get periodontitis and gingivitis soon. And in case of HIV infections, if you have AIDS, that is also a reason. And these are the things, these are the treatment options which you have to take. If you have gingivitis or periodontitis, you should have a good oral hygiene practices. Like you should brush the same thing, and the scaling and root planing. The scaling and root planing means the same thing, which I've discussed before. The tooth cleaning, how we have how to do that, and the periodontal surgery. The periodontal surgery means there are many surgeries like the flap surgery, and there are yeah. So there are many type of surgeries, periodontal flap surgery, and reconstruction of the bone before that, and that will be a bit more topic for you guys. So let's understand the treatment methodology, the periodontal surgery. And as I've discussed before, Yeah, somebody's drawing on the screen. Yeah. So prevention and treatment for bad breath. They somebody's drawing on the screen. Stop. Yeah.
Rayan and Shabas, please stop this.
Can you please stop doing that? Yeah, Rayan and Shabazz, we can see your names, okay?
Ma'am, Abdullah was also doing it.
That's fine. That's fine. They're s- yeah. So prevention and treatment for bad breath. Is it boring? Is the class boring?
No.
I think it's
No, sir.
more. Yeah, I think it's a more bit difficult for you guys to understand, right? Is it?
No, sir.
Kind of.
Are you, kind of, yeah.
Yeah.
Yeah. If you have any doubts, you just ask me after the class complete. Once after the session is completed, right?
Okay.
All right. Is that okay?
Yeah.
Yeah, I'll make it much
Sir.
simpler. Yeah. So for maintaining a proper oral hygiene, sorry. Yeah. So prevention and treatment for bad breath. The bad breath means there are many reasons for bad breath. That is either if you have a bad oral hygiene, if you have a smoking habit, if you like some certain kinds of food, all will leads to the bad breath. So what you have to do is you should maintain your oral health properly and treat the underlying problems. Like if it is dental caries, you have to treat that, and if it is smoking cessation, stop the smoking, avoid certain foods, and keep the mouth hydrated. Drink water properly, all that. So coming to the next topic, it is tooth sensitivity. I think you all guys have seen tooth sensitivity in the TV ads of toothpaste mostly. So there are many reasons. There are many reasons for tooth sensitivity. It can be attrition. Attrition means you guys. I think I believe you know what attrition is. You'll be wearing away of the upper part, the enamel is known as attrition, and erosion means the same thing. It can be due to various causes, and abrasion and cracked tooth and indentation of tooth and gum reasons. There are many reasons for sensitivity. I'll just go through. So next is unattractive smile. See, there are many reasons for unattractive smile. It can be either the malalignment of tooth or malalignment of all set of teeth, crooked teeth, spacing between the teeth, crowded teeth. So all that are the reasons for the unattractive smile. Next is fluorosis teeth stains. As I've told before, if you are applying, yeah, I'll explain it. Rayan is giving a question mark there. So this is the fluorosis teeth stains. Means if you're consuming, if you're having the fluorofluorine above a quantity which is not prescribed, like that will leads to fluorosis. Or in some countries or in some parts of India, the water is fluoridated in order to prevent the caries. So if it contains more than uh, which is to be like the parts per million of fluorides in the water, or the thing which is into that also leads to the fluorosis on the teeth. And next is the tobacco stains. That means you will be having stain due to not for you guys. So as I've told before, there are some medications which leads to the stains on the tooth surface. That means taking tetracyclines, some kind of medications will leads to the tooth stains. and some kind of traumas, like if you have an accident, if you met with an accident, or if you have hit on the surface of your teeth, that will also leads to the discoloration of the tooth. And some people will be having the gummy smile. So your gum is more visible. So in some people, that is just by default. On a bald, there's a chance of visibility of your gum more. That will lead to a bad smile. So there are many treatments for that too. And fracture or missing tooth, that can be either by an accident or due to various diseases. You will miss out your teeth, and that will also lead to an awkward smile. So there are many treatment modalities in order to make your teeth wonderful. One is interceptive and preventive orthodontics. That means you have to intercept, means you have to prevent the crowding of the teeth by using various treatments. If you have that, you have to go to the dentist and you can make it. And habit breaking devices, you'll be having certain devices for digit sucking, means that means your finger sucking. Some people will be having the bad habit, they will always suck your fingers, thumb, all that. And lip biting, some people will be having lip biting, so there are habit breaking devices for that. And some people having the mouth breathing, they'll always breathe through the mouth, that will lead to the procline teeth. So there'll be habit breaking devices for that. And tongue thrusting, you will always thrust your tongue, yeah. So everything, you have some habit breaking devices for that. And avoid certain medications in childhood and pregnancy, like tetracyclines and all. So that will prevent you from staining of the teeth. And avoid smoking. So these are the treatment modalities for a wonderful smile. So you can go for bleaching. See, if you have an yellow teeth, if the procedure called bleaching is done, you'll get a white one. And there are veneers. Veneers, yeah. You have veneers. Veneers means you just have to grind away the upper surface of the teeth, and you'll fix with a small veneers on the surface. That's called veneers. And the crowns means you'll grind away the upper surface again, and you will replace it with total crown structure above the teeth. And implants, if you have a missing tooth, like by a trauma, or if you have a caries, and if you have the extraction, pluck the tooth away, you can drill it, and we have to put a screw inside the tooth. I'm just explaining it in layman terms, and we'll put a crown above this. This is known as the implant. And yeah, there are many other treatments, like as I've told, composites. You can do the restoration above the teeth surface, or periodontal surgery, lasers, teeth replacements, bridge dental implants, zirconia, CAD/CAM, and all. It's much for you guys. And coming to the next, yeah, the oral cancer. So see, the oral cancer means it should not be denied, because it accounts almost 1/3 of the total cancer cases. The oral cancers are if you are taking the 100% of cancers, 33.3% of cancers are oral cancers, and the 90% of the patients are tobacco users. So that can be on different ways, not just by smoking. If somebody is using the tobacco in any way, there is a chance for getting cancer. Yeah, so as you all know, smoking is injurious to your health. There are some constituents in the tobacco or in the cigarette which is poisonous to your health. So these are the most common causes for oral cancer: tobacco use in any form, heavy consumption of alcohol, prolonged exposure to radiation. Radiation means whether It can be through if you are long exposed to X-ray, or if you are long exposed to a radioactive plant or something like anything. So, and prolonged irritation on your cheek or tongue with a sharp object. See, if you don't have a proper bite on your inside your oral cavity, if you have some sharpened tooth there, and if you have a wrong bite, there's a chance for biting on your cheek. That will also leads to the irritation of your cheek, and that in the prolonged term it can leads to the oral cancer. So this is just about the uh, smoking habit. See, if you have after the 20 minutes you're quitting the smoking, and I don't think this is relevant for you guys. Oral hygiene habits, yeah. So these are some oral hygiene habits which you have taken care of. Like you have to brush twice daily. You should brush properly, and you should use soft and either you should use the soft or ultra soft bristles while you're brushing. And if you're a kid, you should use the kid's toothbrush, not the one which is used for adults. And the oral hygiene habits means, see, mostly the problem is what people will do is they will use the brush for a long term. It's not good. The bristles will wear off by its usage more than 3 months and all. There is a wearing away, or the bristles will go in some other directions. So that will be uh, a problem with the proper cleaning of your teeth surface. So you have to change your brush every 3 months when the bristles are flared. Coming to the oral hygiene habits. So as I've told before, some people will not be aware. They'll not be knowing about the dental flossing. See, this is a dental flossing. You can see, as you can see here, it will remove the plaque and bacteria from the areas where the brush cannot reach. So, there is an area in between your teeth. That area should be cleaned using a dental floss. So that is best done before the brushing, and I'll explain you how to do the dental floss. So you can use an 18-inch. So you'll get that. See, you can see here. You'll get a dental floss from a pharmacy. You can take it, and you have to use about 18 centimeter of the dental floss. Sorry, 18 inches of a dental floss, and you have to leave 2 inches both sides in order to wrap around your fingers and gently flows into the curves in between your teeth, and be sure that it should be beneath your gum line, because it should not hurt your gum, and that leads to bleeding, and in order to avoid unwanted snapping of the flosses on the gums. So that's the way how you floss your teeth. Am I running out of the time? Is it audible? Yeah. Hello.
Yeah, you're not running out of time.
Yes.
You have a
Yeah.
fine.
Yes.
Yeah. So, coming to the oral hygiene habits, see,
Creepy.
about the mouthwashes, best done.
For the most.
Yeah, it should be after 1 hour of the brushing, and consult your dentist. Help you choose what kind of mouthwashes you have to use. You should not just blindly go to the pharmacy and get a mouthwash and use it. You should consult the dentist which kind of mouthwashes which you have to use. Either it can be chlorhexidine or fluoride and the sensitivity, whichever you're supposed to use. And you can use some kind of sugar-free chewing gums that will help you to. There are many things that people are using chewing gums for. You'll get a proper jawline sometimes if you're using the chewing gums all
Chewing
time.
gum is good.
Yeah, chewing gum is good. Yeah.
Yeah.
Yeah, it should be sugar free, but you can use after 15 minutes of a meal, and that will also stimulate your salivary secretion and remove the food and debris and plaque from your mouth and reduces the resistance. If somebody is a smoker, there are chances to reduce the urge of smoking. And oral hygiene habits. You can use a fluoridated toothpaste, and if somebody is below 3 years old, they have to use non-fluoridated toothpaste, which is supposed to which you'll get in the pharmacies, and anti-sensitivity toothpaste if somebody is having sensitivity on the surface of the tooth, which should be taken after a consultation with the dentist. And this is a final topic which we are discussing. So for having a good oral health, it is very important. Not only oral health, for having a good health, overall health, you should take a proper diet. Avoid eating sweets more. Not like you should not eat sweets and sticky foods. You should reduce it, and you should wash your mouth properly after having this kind of foods. And if you're taking more aerated drinks like Coca-Cola, Pepsi, and all, if you're taking it more, that will also leads to little case, because the carbonated drinks are acidic. It contains carbon dioxide, carbonated. That leads to dental caries. If you're taking it more, you just try to reduce it. And eat food rich in fiber. Means you should eat more fruits and vegetables, and that will help you to digest your uh, foods better. And drink a plenty of water. That will hydrate your body. That will help you to prevent from many diseases. And sip some water after eating. That means after all your food, you should drink some water. That will help you to dilute the acids, even from the oral cavity and inside your gut. And you should rinse your mouth after every meals. You should not just wipe away your surface of like you just not wipe away by using a tissue, and you should not go off. You should rinse your mouth uh, properly after every meals. So that's it. Thank you. That's all for today, guys. Thank you. If you have any doubts, you can ask.
I
Yeah.
have three doubts.
Yeah,
So there is a thing that we put in our mouth, like a spray. What is it?
a spray.
Yeah,
Like before the extraction, or
yeah.
before what?
Before we start, when we say
Say it again.
a spray, a spray that we spray in our mouth when we go to dentists.
Yeah. Yes. So I got it. Yeah. So that's basically known as a local anesthesia spray. Means that is used to get rid of the pain from the tooth surface. Got it? So if you're
Okay.
spraying it on the gum, that will imbibe inside the area, and that will prevent you from getting hurt. Means getting the pain. You got it? It is an anesthetic agent that will
Yeah,
prevent you from getting pain. Got it?
yeah.
That will makes you numb on the surface.
Okay.
If you're giving the injection, same again, it is an anesthetic agent that will make you numbs all the area. That will make you easy for the extraction. So in some cases, we don't need an injection. So what we will do is we'll just the spray on the surface. Got it?
Got it. And there's when in our teeth there is a white thing, like when we don't brush a lot, a
Sorry,
white thing.
say
Like
again.
when we don't brush a lot, there is a
Yeah.
white thing in our teeth. What is it?
Sir, I've come across that. See, that are the pellicles. That means that are the plaque. I think I have come across that. I'll show you that again. Wait, that will be more understanding for you guys. So, as I've told before about the, see, you can see removal of infected deposits, the plaques and the calculus, and the stains means different. The white things are the plaques and calculus, which is attached to the surface of the teeth. So you can see here there is something. You can see here the white and yellowish substance which is attached to the tooth
Yeah,
surface.
yeah,
That is
yeah,
no,
yeah, yeah.
yeah. Those are known as the plaque and calculus. This is
Okay.
basically the calcified structure. The calcified means your saliva contains some calcium and all, so that will lead to the calcification. That means that will make you that will make a calcified structure on the surface of the teeth. Got it?
Okay.
Yeah.
And what are some food and drinks that are good for teeth?
Foods and so as I've told before, you can take 1 second. You can take more fiber-rich foods, and you should take the normal water. Instead of taking the aerated drinks, the carbonated drinks, you should eat more fruits and vegetables, and you should,
Okay.
yeah, yeah, I've shown you there. See, you can see here, yeah,
Yeah. Okay, okay.
I have a question.
yeah, yes, should.
Okay, so my question is like, can you explain the latest advancements in dental technology and how they might benefit my oral health?
That's a great question. See, there are many latest advancements in the dentistry, like we have artificial intelligence incorporated in the field of dentistry. I think you guys will be aware about artificial intelligence, right? I
Yeah.
think, yeah. So there are some kind of robots like which will do the dental treatments. You will. It's not in all clinics and all, but they are on research. You don't need a dentist to do your dental procedure sometimes. Some dental robots will make uh, drill the hole on your surface of the tooth if you have a dental caries, and it will do the restoration by itself sometimes. It's on the research anyway, but although that's a thing which is new in the field of dentistry. That is an advancement, and uh, there are many others too. Like you will be having the new kind of restorations on the surface of the tooth in order to match the colors of the teeth. Got it?
Yeah.
Yeah.
Like, what are the most recent developments in periodontal treatments and how might they apply to my situation?
Periodontic treatments means, see, first for everybody's knowledge, the periodontics means the dentistry of pediatric patients. It's known as the yeah, for the people who didn't get it. So the pediatrics means the periodontics means the dentistry relates to the pediatrics. And and what was your question?
Like, what are the most recent developments in periodontal treatments and how might they apply to my situation?
Yeah, it actually depends upon what kind of treatment you need. And there are so many advancements in day-to-day basis. There are so many researches going on in the field of dentistry. Like what kind of treatment it requires depends upon that. Like what kind of treatment you're concerned with, what kind of treatments you're concerned with, like if it is a restoration, if it is an implant, or if it is like if it is an ortho treatment, means if you have a malaligned teeth, what kind of treatments you're concerned with?
Mm,
Sir, I have one question.
Yeah,
I have one more question that is the last one.
yeah.
How do you stay current with the latest research and advancements in de- dentistry?
How do you say it again?
Like how do you stay current?
I think one person can ask one question, or else like it will take a lot of time, right?
Yeah, okay.
Okay.
Okay, can I
Yeah,
ask?
Sir, I have one
yeah,
question.
yeah. Ask me. Sure.
Okay, my question is, the tooth needs to heart attack. Tooth problem needs to heart attack.
Yeah. See, that's a wonderful question. That is a wonderful
How?
question. See, I'll explain. See, there is a relationship with every parts of, as I've discussed before. There is a relationship with other parts of the body for your teeth, because in some cases, if you have an infected tooth, if you have an infected tooth, there will be bacteria inside your tooth, inside your teeth. So the tooth means inside the pulp. As I've told, this is a pulp. I'll show you. This is a pulp, right? You can see the pulp here.
Yes, sir.
Yeah.
Yes, sir.
So yeah, if there is a caries or if there is an infection on the surface of the tooth, there can be a chance the bacteria will goes inside the bloodstream. The, there is a chance for black bacteria goes inside the bloodstream, and that will leads to a condition known as bacterial endocarditis. So the bacterial endocarditis means the cluster of bacteria, the bunch of bacteria will go inside your uh, valves of your heart. You know the heart valves, right?
Sir.
You
Yes,
know,
sir.
yeah. So there is a chance of attachment of those bacteria on the surface of your heart, and that can lead to a block. Even that can lead to a heart attack. Got it?
Okay, thank you, sir.
Yeah.
I
Thank you.
have a question, sir.
Yeah.
Can you explain the importance of a regular dental checkups for maintaining oral health?
Wonderful. Yeah. So as I've told before, from the younger days, if you're a kid, if somebody is a kid, like from the age of to the after the eruption of the teeth. Anyway, if you don't have a teeth, you don't need a dentist. So from the younger age, uh, if you do the fluoridation proper, like fluoride application, as I've told discussed before, what a fluoride application is, as I'll show it again. See, this is a fluoride application. From the younger days, if you visit a dentist, uh, after your permanent tooth, say it like that, yeah, or before the eruption of your permanent tooth. Anyway, any time, if somebody visits a dentist, and if you're asking for a preventive measure, we'll do a fluoride application. That will help you to prevent from caries. That's a primary thing you should understand, because if you apply the fluoride on the surface of the teeth, there is less chance. There is a less chance for getting caries on the surface of the problem solved first. And the second thing is, if you have once after that, if you are visiting every 6 or 1 year, if you're scaling properly, means the teeth cleaning properly, you will be having less chance of getting the diseases as I've discussed, like periodontitis, gingivitis, or the dental caries, etc. So that will help you to lead a good oral health, right?
Yeah.
Yeah.
Okay,
So,
thank
and
you, sir. Now,
obviously the dentist will explain you how to brush your teeth properly, and what all cares you should take in order to have a good oral health. So as I've told before, there are so many relationships between the oral health and your normal health.
thank you, sir.
Okay.
Yeah.
Okay. I think now Ihan can ask this.
Yeah.
Hi.
Can I hear?
Yeah, you can ask your question.
So is
Shoot.
teeth
Yeah.
and tooth the same?
Sorry.
Is tooth and teeth the same?
No, tooth is singular and Teeth is plural.
Okay.
Yeah.
Can I ask?
Sorry?
Can I ask?
Yeah, shoot. Yeah. Come on.
What will happen when we sleep with mouth open?
Yeah, that's a wonderful question. So as I've discussed before, there is a chance of proclination of your teeth. Means there's a chance of some. Have you seen some people with the teeth up? Some people will be having the teeth upwards. That's known as the proclination of teeth. Means there is a chance of lifting of your teeth up towards your lip.
Okay.
Yeah, and there are many problems if you're doing if you're sleeping with mouth open. Yeah, there is a chance of mouth breathing. You'll do the breathing through your mouth. That is not good for your health. So there are many methods in order to prevent the mouth breathing habit or opening the mouth and sleep. There are many preventive measures in orthodontics, in the field of orthodontics and dentistry. So you can consult so if somebody have a problem, they can consult the dentist. They will find the cure.
Okay. Thank you.
Good. Now, did Fatima Amna already ask the question?
Yeah. So,
No,
so
I
say it again.
haven't asked the question.
What was the
So you
question?
can ask your question. You can ask.
Okay, so I have a question. So I
Yeah.
have heard from people that if when you are when you are a kid and one of your tooths are going to you will shake it and then it will come out, right? It will be loose and then it will come out.
Can you say it again?
Okay, so
It-
when one of your teeth comes out, like when you are a kid,
Okay,
so
not like by
third
itself, right?
one,
If it is
what?
coming out by itself, you're asking whether a tooth
Yeah,
is
yeah,
coming
yeah,
out by itself
yeah.
or
So when it's
by your effort.
by my effort, like that.
Okay. All right.
Okay,
Got it.
so when it's very loose, when it's time to take it out with your hand, I've heard that if we should not take it out, like pull it to the front. You should pull it from the back and take it out. Is that true?
It is like partially true because see, in case of if you are plucking your primary teeth, there are see, you should understand one thing. The tooth which is shedding out when your kid is known as the primary teeth. Primary teeth means the teeth which you will get once after your birth, after 1 year or whatever. That is known as the primary teeth, and that teeth will go away, and the next set of teeth is coming to your teeth for your further life is known as the permanent teeth. So at the time of uh, eruption, before the time of eruption of your permanent teeth, your primary teeth will shed off. Sometimes it will go by itself because there will be a pressure from the permanent tooth which is erupting from inside the socket. There will be a pressure from backside of the tooth, so that will lead to automatically shedding away of your primary teeth. There is a chance like that. So always in case of primary tooth, the tooth will be loose, right? You will feel that the tooth will be shaking once
Yeah.
you're doing that, right?
Yeah.
So if you're plucking it forwards or backwards, it depends upon. If it is more loose inside the oral cavity, it doesn't matter. If it is tight inside the oral cavity, there is a chance of breaking of bone.
Okay.
So you have to taking care of how you do that. Like it's not, yeah. So if it is very tight inside the cavity, if you're trying to give more pressure with some even with your hand, there is a chance of injuring yourself. So if it is loose, you can pluck it anyway. There is no issues with that.
Yes.
Yeah. Anyway, you'll be having a pressure from like from the permanent tooth which is erupting from the socket. So that will makes you to
Sir,
take it.
I have a question.
Yeah.
Like whenever we bite metal things, what does we feel like something sore in our mouth?
Yeah. That is like you'll feel like a metallic taste inside. You will feel so like if you're biting an iron or something, right?
Yeah.
That's about your taste buds, buddy. It's nothing about the teeth. That's because if you have a taste buds on your tongue, right? So yeah, you'll be having that's
But
not about your
sometimes you get like tingling on your teeth.
tingling onto it. Yeah, that's because the as I've told before, there is a part called dentin inside your teeth. The metal particles will imbibe inside the dentin, and that leads to a sensitivity. As I've told before, the reason for sensitivity is the dentin. So, in some cases, if you have an attrition, if your enamel is not much strong, or in some cases, in the metal particles will uh, uh, oozes inside the dental tubules, and that will make you sensitive on the surface of the tooth.
Thank you, sir.
Yeah.
Okay, I think Devashish, you can ask your question.
Yeah. So, my question is, people say like you're not supposed to use certain kinds of toothpaste unless your dentist has recommended it, right?
Yeah.
So, what actually happens if you use a different kind of toothpaste?
See, the basic thing is almost all the toothpaste manufacturers, like by example, I'll say, see if you're using a Colgate or if you're using a close-up, the Indian brands, yeah. So those toothpastes are actually made uh, by default, which is mostly like just usable for the common public. There is nothing like you should not use this, that one. But in my opinion, the best toothpaste is the normal white Colgate toothpaste because it is having the less abrasives in it. If you're using a gel toothpaste, it contains more abrasives. You know what abrasives are, right?
No, unfortunately I don't.
You don't. Yeah, abrasives means it contains more particles um, which will grind away the surface of the teeth. Like small particles, there are chances of grinding of more particles on the teeth. Anyway, every toothpaste contains that. There are small granules that is actually needed for the cleaning on the surface of the tooth. So in case of gel toothpaste, it contains more amount of fillers and as of all the particles, the abrasives. So that will lead to more chipping away of your enamel. There are some studies saying that. So it's better to use, mostly some article says that it's better to use the white toothpaste instead of the gel toothpaste. And coming to the topic, as you were asking, if you're using a sensory toothpaste, means an example for making you understand easily. If you're using an obtundant toothpaste, obtundant means something, some toothpaste which will help you to reduce the sensitivity is known as an obtundant. So if you're using that without having a permission from your dentist, as you are seeing the Sensodyne, if you're a kid, you're using a Sensodyne toothpaste every day, that is not actually prescribed. If it's not prescribed by dentist, if you don't need that, that won't be good for your teeth. And about it, it's all about the medicated toothpaste. There are two kinds of toothpaste. One is medicated, and the one is the normal ones. If you're using the normal ones, then it's fine. And if somebody is below 3 years old, it is better to use non-fluoride toothpaste. As I've discussed before, I don't know, I've discussed somewhere. If somebody is a kid below 3 years old, it is better to take always brush with a toothpaste which is non-fluoridated one. We will get in the pharmacies and in some supermarkets and all. So that's better.
So like I'm 11 and
Yeah.
I'm 11 years
Yeah.
and like am I supposed to use the toothpaste that's meant for kids or like can I use my parents' toothpaste as well?
You're 11, right? That's fine. You can
Yeah.
use the normal toothpaste. There is no issues. You're using the
So,
normal
say
toothpaste.
I was younger. Suppose I was below 6. Then would anything happen to me?
Below 6 is also fine, but see, it's all marketing ideas. If somebody is saying that there is a toothpaste which is good for you below 6 years old, there are toothpaste in the market like that. But if you're brushing the teeth with fluoridated toothpaste at the age of 6, that's fine. There is no issues. It's all about the market. If you get the toothpaste written that if it is below 6 years old, people will feel that yeah, that's good. Like how things work on the case of Horlicks, Boost, and all. There is nothing happening with the Boost, Horlicks, and all, right? So
Yeah.
it's about the market. Like some people will promote that, some dentists will promote that for their personal benefits. There is nothing much about you should use a kid's toothpaste before below the age of 6. Got what I'm saying?
Yeah.
Yeah.
Okay,
Yeah.
wait. Now I think we can like wrap up the Q&A session. So now I'd like to invite Adila to present. Adila, is there?
Yeah. So can you please stop so I can present?
Yeah.
Sorry. Say it again.
Can you please stop presenting so I can present?
Yeah. Yeah. Thank you.
Now on navigating common dental challenges. Yes.
So yeah, as we draw near to the end of this enlightening session, it's time to express our gratitude. Joining us for the vote of thanks is Ihan. So please welcome Ihan here.
Okay. As we conclude this insightful webinar on dental challenges, a big thank you for our special guest, Dr. Aslam, for sharing valuable insights. Your expertise have been truly enriching. Let's take Dr. Aslam's wisdom with us as we leave today. Thank you all for being a part of this evening. Have a wonderful day ahead.
Thank you.
Okay,
Thank you so much, buddy. Thank you, Ihan.
Yeah,
Thank you, guys.
thank you, Jan. Yeah, thank you, Jan, for those heartful words of thanks. And with that, we bring this webinar to a close. A big thank you to Dr. Aslam, Muhammad,
Thank you. Thank
Adila,
you so much.
Jan, and all of you who joined us today. Until next time, stay inspired and keep learning. Goodbye.
Thank you. Thank you so
Yeah.
much.
Then we can wrap it up.
Thank you. Now everyone can leave.
Yep, we can leave.